at the Sadanah Trauma and Surgical Initiative in Chicago, but I think more importantly, with respect to the college, she is one of the principals in the organization called InciSioN, which she'll talk to us about today.
Hello, everyone. Thank you so much for the opportunity to share the work that InciSioN, or as we like to refer to ourselves, the future of the operating room, has been doing in the global surgery arena. I bring you the greetings of the InciSion's current chairs. I am the immediate past chair of InciSion, and I bring you the greetings of my colleagues and current chairs and the executive board of InciSion, and other than that, I have no disclosure. So to talk about InciSion, we need to start by talking about what have trainees done in the global surgery field overall over the years. The first formalized historic document that we can find is, and I know the word historic here is contextual, but it's from 2014 with International Federation of Medical Student Associations, IFMSA, where they released a policy statement on safe surgery and anesthesia. And along with it, they launched a call for formation of what they called at the time the small working groups in global surgery. Within less than a year, 6 of these small working groups were formed. Unfortunately, shortly after, IFMSA's priorities shifted away from surgery into more community and infectious diseases. And the 6 groups that were formed, those small working groups came together and formed what is today known as the International Student Surgical Network, or InciSion, and that's our original logo. And we were established formally as an NGO in Belgium in 2017. Our work rests on 3 pillars of advocacy, research, and education. And over the years, we have been collaborating with the members of the global surgery community at various levels, from local levels to high levels, such as the WHO. We have actually been part of the delegations each year to advocate for safe surgery. Here you can see our presence at the Consortium of Universities for Global Health for this global surgery satellite session. For the past 5 years, we have been either part of the planning or also have presented during these sessions. We have grown and our logo has changed. Now this is our new logo. We launched the first ever student and trainees in global surgery session at the American College of Surgeons Clinical Congress in 2019. This was the first time the college allowed a trainee session to be planned by students and trainees, and it's now 3 years old. Every year we have hosted it, and the demand for it has been increasing. Our members on a local level have been part of the National Surgical Obstetric and Anesthesia Planning, and we have been a part of the planning and development of the Association of Academic Global Surgery, which is one of our newest partners. Here what you have is essentially the structure of InciSion. This is our international team here that supports the network of our national working groups and sets our global agenda. The international team is led by an executive board which involves all these VPs and directors along with the chairs, and it's advised by the board of trustees and board of advisors. So essentially what you see here is all students, trainees, and early career providers less than 5 years into practice. Our international team is usually selected in December. This year's team has 98 members, 58 of which are women. More than 60% of the members are from LMICs, and they speak over 40 languages and come from over 45 countries. In terms of advocacy, we have a set of annual campaigns that we run every year. You can see the list of them here. The most important of which is the Global Surgery Day campaign. We launched Global Surgery Day in parallel to the passing of the World Health Assembly Resolution 68.15 on emergency and essential surgery, and it's celebrated each year on May 25th. We have various collaborators for our advocacy efforts. You can see some of the examples: the World Federation of Societies of Anesthesiologists, LifeVox, and G4 Alliance. Here's an image from Rwanda on the ground, one of our advocacy campaigns for universal health coverage. The same campaign on social media. A social media event for US Aid campaign along with our US National Working Group, which you might have heard of. It's called the Global Surgery Student Alliance. And an example of how we celebrate Global Surgery Day now, we have usually a week-long program. In terms of education, we have 5 areas of focus: education for professionals, internal capacity building, public education, content development, documentation, and opportunity provision. Here is an example of our internal capacity building activities improving management skills of our members. This one is, our webinars on COVID, which in 6 episodes reached an audience of over 20,000 people around the world. And finally, we hosted and launched the first ever Global Surgery Programs Director Fair this year at the American College of Surgeons Clinical Congress. We had a partnership with the resident associate groups of ACS, AAGS, Operation Giving Back, and our own US-based national working group. Our research arm has been working internally and externally. Internally, we have the InciSioN Research Proposal Program, which is modeled after the NIH grant proposal process, allows our members to not only develop grants, research proposal grants, but also review them and learn how the review process works. And these proposals are usually adopted every year to be carried out in our network of national working groups. We have the Global Surgery Journal Club, which happens every second Saturday of the month on Twitter. And it's not only attended by our members and some of the premier researchers in global surgery, but we've had patient advocates join us as well. We have multinational research projects, such as the ISOMER study, which come from our national working group chairs. ISOMER specifically looked at the interest and knowledge of final year medical students in global surgery. It is the largest data set to date to be collected regarding that and regarding the demand for global surgery education, as it spanned 20 countries. And it was presented actually in Thailand at ICS meeting. Finally, we have the InciSioN Research Capacity Building Program, which is a conceptual and practical research training program that we carry out every year. And some of the outcomes of its first run have actually been presented at various international conferences. Last year's awardee for the scholarship program actually was from that program. Our external projects and collaborations include from World Bank to what you see on the screen with the logos of our collaborators, and our latest and this year's collaboration is going to be with Operation Smile. Here's a visual abstract from the Journal Club, and this is ISOMER's paper that is open access and you're welcome to read. This is the network of our national working groups currently spanning over 50 countries and all of the WHO regions. Majority of them are low middle income countries. These are groups that are independent locally, but they follow our national networks guidelines, and their work is also based on the 3 pillars of education, advocacy, and research. The international team supports their efforts and invites them to participate on the international level in decision making and in all of our campaigns and projects. They're essentially the heart and soul of InciSioN. This is our collaborators, some of them. The ones that I haven't mentioned yet is the Journal of Global Surgery, which is a novel open access journal that is supported by Bitcoin. JOMI, which is a video journal. The Students for COVID was an initiative we actually launched. It was a multidisciplinary initiative to support grassroots efforts during COVID. And finally, InciSioN has applied for the ECOSOC consultative status for WHO. We run the world's largest global surgery conference, and it is completely planned and run by medical students and residents. The first iteration of it was in Belgium in 2018. The second one was in Kigali, Rwanda. We select these locations in rotation and in collaboration with our national working groups to hopefully divert audiences of global surgery community to different regions of the world. In 2020, we were due to go to Colombia, and only a few weeks shy of the conference, we had to postpone, and we went virtual for the first time. And in 2021, Bosnia-Herzegovina was our host, and this is a conference that was actually supported by a very generous endowment from the ICSUS section. Here are some of the images of the past conference. This is Belgium, this is Rwanda, and this is essentially Colombia. ICSUS 2021 attracted over 1,300 attendees from 97 countries because we were able to provide the conference for free thanks to ICSUS section. It was 5 days long, 7 workshops were held, and many of them were certifying. Over 100 international expert speakers were present at this conference. We had 15 oral and 30 poster presentations, and live translation to Spanish and Bosnian as language limits access, and it's a problem for equity in access to global surgery education. So these are some of the images of the conference. You can see our panels. And this is one of our workshops. Over the last 2 years, the ACS trauma teams has been held at our conference, and we have certified over 300 people around the world with teams. We have an award that we give away. Dr. Mahler is the namesake for the award, Mahler Mentorship Award. It's awarded annually to an international mentor, who this year was Dr. Kathleen Casey, and usually to a local mentor as well that is identified by our national working group that's hosting. This year's national award was given to Dr. Ibrahim Omerdovic. Now, InciSioN and ICS-US section have a lot of shared vision, and they can have a very strong partnership that will support the future of global surgery. We call ourselves the future of the OR, and ICS-US section and its members have been the past and the present of global surgery. We are here today because of the efforts that each and every one of you have done and contributed to the field. What InciSioN brings to the table is sustainability. Speaking of that specifically would be longevity as the age group of our membership, diversity because of the profile of what I shared with you of our members, and also social media presence and marketing that can expand the profile of the ICS-US section. What InciSioN expects to gain from this partnership is mentorship in research, career development, and leadership, because all of those are areas that we really need help and support in. We can always use research mentors. There's no student or trainee in the world or early career physician who will say otherwise. In terms of career development, again, you have built the field, you have done all of the work that has brought us to this point, dealt with the challenges, so no one is better suited to give us this advice that we really need. And when it comes down to leadership, I don't think I can add anything more than the wonderful presentation that we had earlier today, and it highlighted how key mentorship is there. And finally, with that, I would be happy to answer any questions, and this is our contact info. I tried to be fast. I hope that was helpful.
That was wonderful. Thank you. I guess in the interest of time, I don't know if we'll have time for any audience questions, if there's any questions, but I want to congratulate you on just a tremendous work in galvanizing a global population of enthusiastic and really harnessing, I think, an energy that is going to be key to the future of global surgery. So I am really looking forward to seeing all the fruits of the collaborations that your organization has formed. I think it's going to be wonderful. Thank you.